Earlier tonight, Jay Glazer reported that not only did Baker Mayfield tear his labrum on this play, but also suffered a fracture to his humerus. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. This is a classic type of story that I in part started this channel because I wanted to give you guys the real explanation of what's going on when we see stuff like this reported. Because to be honest, this is kind of a little bit blown out of proportion in terms of it sounds a lot more serious than it really is. Now, we already knew that Mayfield was dealing with a shoulder injury before this play last week when he dove here, and that left arm gets outstretched away from his body. And this is a classic position where we can see shoulder dislocations. That arm is extended back behind him. It's a little bit externally rotated outwards in this abducted position. In this position, you get this combination of forces where the lever arm from the humerus, the arm bone here, basically forces the arm to want to pop anterior or forward while the rest of the body is going backwards. So when you're pulled back in this position, that tends to drive the arm bone forward, making you predisposed to a dislocation, especially in somebody who's already had some instability there. This is the exact position where something like this would happen. The torn labrum part of this is a lot easier for the general public to kind of understand and wrap their heads around. But what we often miss in the news is that these injuries are more complex. There's other features, there's other characteristics beyond just what we hear about with the torn labrum. And this is a perfect example with what we're hearing about with Baker. If we look at our biodigital anatomy tool here, we're showing a left shoulder. So of course the arm bone here, that's the humerus, that's the ball of the shoulder. And then the socket is the glenoid. If we hide some of our rotator cuff muscles here, now you can really clearly see that ball and socket of the shoulder joint. And then of course the labrum is this rim of cartilage that goes around the glenoid to provide some additional stability and help to kind of deepen that socket of the shoulder. If we look top down here, what's basically happening when Mayfield had this dislocation episode is the humerus comes forward this way. What that does is the ball of the humerus shears the front of the labrum as it dislocates anterior. Now, whenever that happens, you can end up with this back outer portion of the humerus or the arm bone basically knocking up against the hard bony portion of the socket. So you've got hard bone socket, hard bone of the ball, the humerus, and when it pops forward, it impacts on that portion of the glenoid. So beyond just the labrum tear, you can have bony injuries with the shoulder dislocation. Specifically in the case of Mayfield, what they're talking about is almost certainly something called a Hill-Sachs deformity or a Hill-Sachs lesion. If we get rid of the rest of our rotator cuff muscles to show the rest of that humerus, a Hill-Sachs lesion is an impaction fracture that occurs kind of on this posterior and lateral aspect of the humerus. So kind of this back and outer part of the arm bone. Again, that's the part of the humerus that whenever the shoulder dislocates forward, impacts up against the front of the glenoid. Usually these things are quite small. This isn't like the arm bone just snapped in two. Fractures are on this continuum in terms of severity and characteristics. And something like a Hill-Sachs lesion is definitely on the more kind of minor side of what we would consider fractures. Now, that doesn't mean that they don't cause a lot of pain and can contribute to overall decision-making with the need for surgery and potentially lead to other aspects of surgery being needed to help kind of fix that bony lesion. But this really needs to be thought of as more associated with the shoulder dislocation rather than like a second injury. You know, this isn't like he's got just this fracture line cutting clear through his humerus where his arm is just hanging in two. So what I want you to understand with these injuries is it's really, really rare and unusual for the only thing abnormal in a dislocation episode to be a torn labrum. We very commonly see these Hill-Sachs lesions or Hill-Sachs fractures. We can see a bony Bankart fracture. You can have other specific ligaments around here that I'm not showing on the anatomy model that can be torn that almost make it certain you need surgery versus a small, tiny little labrum tear that can heal well on its own. Now, Jay Glazer did have a follow-up tweet saying that Baker described this as a tuberosity fracture, which I think just kind of further clouds where this thing really is. If we look back at our anatomy, there is an area of the humerus called the tuberosity up near the top here. There's specifically a lesser, this bump right here, and a greater, the bump more on the outside. And these are locations where the rotator cuff muscles insert. So yeah, with a shoulder dislocation, you can see a fracture of the greater or lesser tuberosity, but those aren't things that are gonna just heal within a week, like Baker was suggesting supposedly to Glazer. Now, certainly if there's just like some tiny little hairline crack that they couldn't even see on X-ray and only picked up on the MRI, then maybe a time frame like that would be more potentially realistic, but still, I think it's more likely that they're describing this Hill-Sachs, which kind of sits in the area of the tuberosity, It's harder to describe and use the term Hill-Sachs than the location of the bone that's potentially fractured. Either way, in the whole setting of a shoulder dislocation, this still isn't like a fracture line just cut clean through the humerus where he's playing with a broken arm. Putting everything together, I think it's most likely that we're talking about one of these Hill-Sachs lesions, because certainly if he had a true fracture through the greater lesser tuberosity, usually those things take multiple weeks, and we're talking about surgery because they can really involve the rotator cuff, and it's not like a thing you're gonna try to play through and potentially not even miss a week like we saw with Baker. So to go back one more time to the play here, keeping our anatomy in mind, when Baker dives out, that left arm is outstretched in front of his body. Behind him in that extended, externally rotated, abducted position, and in this position, remember, his arm bone, the humerus, is positioned right here, wanting to push forward out the front of his shoulder. It eventually has enough force that it dislocates. The outer portion of the head of the humerus impacts against the socket of the shoulder. That impaction causes a small little focal fracture called a Hill-Sachs lesion, but again is part of the overall picture that we see with a shoulder dislocation. So that's it for the video, everybody. I hope it was educational to kind of learn a little bit more about what exactly is meant by all these reports we read about. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.